Hello, Barton interpreters. This is Julie Burns coming to you live from Santa Rosa. Hope you are all doing well. This 1-hour workshop, for which you will earn 1 CEU if you complete all the assignments as instructed, deals with professional boundaries and saying no. As you know, as interpreters, we are often faced with the challenging task of saying no to patients or providers when we are asked to perform tasks that go beyond our role boundaries. Simply saying, "I can't do this, it's a violation of my ethics or role boundaries," often frustrates and alienates both patients and providers. They don't care about our role boundaries, they simply want our help. So this workshop will review some of the ethical principles and standards of practice that may be impacted by not saying no, when it is actually in the patient's and the provider's, as well as the interpreter's, best interest to do so. We will also review the 3-step model for saying no in a professional and gracious manner, and give you the opportunity of scripting and practicing ways to say a professional no in a variety of scenarios. So these are the 3 codes of ethics from the National Council on Interpreting in Healthcare that are most likely to be impacted by violating our professional boundaries by saying yes when we really should say no, or by saying no in an unprofessional way. So let's go over them. Respect. Interpreters treat all parties with respect. Impartiality. Interpreters strive to maintain impartiality and refrain from counseling, advising, or projecting personal biases or beliefs. And third, professionalism. Interpreters always act in a professional and ethical manner. And now let's look at each one in a little more detail, along with the corresponding standards of practice, to see how they could be impacted by not saying no, or saying it in an unprofessional manner. So we'll start with respect. And here are the standards of practice related to the ethical code of respect that may be impacted. The interpreter uses professional, culturally appropriate ways of showing respect, promotes direct communication among all parties in the encounter, and promotes patient autonomy. So how could these be impacted? Let's look at the first one. The interpreter uses professional, culturally appropriate ways of showing respect. Let's imagine the provider asks you to do something inappropriate that you find personally upsetting, such as in the following scenario. You're interpreting at the bedside of a bedridden patient in the hospital. The nurse is trying to get the patient to stand up out of bed and asks you to help support him. You have a bad back, and this patient weighs over 200 pounds. Out of fear of injuring yourself, you might blurt out something like this: "No, I can't do that. It might hurt my back," in an aggrieved and disrespectful tone. Now, you said no, which was appropriate, because in this instance, even though you might also play a different role at Barton, which would allow you to have this type of patient contact, at the moment you are wearing your interpreter's hat. What wasn't appropriate was the way you said no, which probably would alienate and frustrate the provider. Let's look at the second one. The interpreter promotes direct communication among all parties in the encounter. Let's say the patient whispers a question to you about whether she should agree to a medical procedure the provider just suggested, while the provider is looking at the computer screen, and then asks you not to tell the provider. You don't want to upset the patient by refusing her request to keep quiet, nor the provider by questioning her authority, so you say nothing. You managed not to upset anyone, but did you promote direct communication between all parties? And finally, let's look at the third one. The interpreter promotes patient autonomy. Suppose you're interpreting for a patient that you recently interpreted for at a different clinic. The provider asks her a question, and the patient asks you to answer, saying that you know all the details already and can answer it better than her. You don't say no because you're kind of happy to show off your knowledge and good memory, so you launch into a summary of yesterday's visit. Both the provider and the patient are happy. You saved the provider time, and the patient didn't have to struggle expressing what she understood from yesterday's visit. But did you promote patient autonomy? I don't think so. Okay, now let's look at the Code of Ethics on impartiality. Here are two of the standards of practice related to the ethical code of impartiality that could be impacted. The interpreter does not allow personal judgments or cultural values to influence objectivity, and discloses potential conflicts of interest, withdrawing from assignments if necessary. So again, let's look and see how these standards of practice could be impacted by not saying no when appropriate or by not saying it professionally. Let's look at the first one. The interpreter does not allow personal judgments or cultural values to influence objectivity. For example, your decision to say no might be influenced by these, rather than by an objective assessment of the request. Let's examine the next standard of practice. The interpreter discloses potential conflicts of interest, withdrawing from assignments if necessary. So imagine you are assigned to interpret for a patient, and when you arrive, you realize it is your sister-in-law's mother. She seems happy to see you, but you're worried because of some issues that are going on in the family, and you don't really want to be involved. You don't want to hurt her feelings, though, so you say nothing and carry on with the assignment. The patient seems okay, and the provider is oblivious to your concern. But did you disclose the potential conflict of interest? No, you didn't. All right, let's discuss the last one, professionalism. Here are the standards of practice related to it that may be impacted. The interpreter discloses skill limitations with respect to a particular assignments. The interpreter avoids sight translation if he or she lacks sight translation skills, and the interpreter shows respect for professionals with whom he or she works. So let's look at an example that addresses the first two, since we already discussed an example of respect. Let's imagine the following scenario. You're interpreting for a patient who is being prepped for a complicated orthopedic surgery. The surgeon rushes in, hands you the informed consent form, and says, "Can you please translate these discharge instructions for the patient? I'll be back in a few minutes." You're just recently certified, and you really don't have much experience in orthopedics. You look over the form quickly and realize you are way out of your depth. But the patient is looking expectant, and the surgeon is about to step out of the room. So you take a deep breath and start stumbling through it, wondering if you're getting it right. The doctor gives you a big, grateful smile as he steps out of the room. But did you disclose your skill limitations and avoid a task you are not qualified to do by not saying no? I don't think so. So I hope these examples help you to recognize that not having a reliable technique to say no can lead to inappropriate decisions, unwanted consequences, and can alienate and frustrate patients or providers. So let's review a simple 3-step technique for saying no with professionalism and grace. These are the 3 steps, and as you will see, the secret is in the order of the steps. Usually when we say no to a request, we immediately give the reasons for our no. If you've ever tried this with your kids, or anyone else in your life for that matter, I'm sure you agree that it doesn't usually work very well. The key is to start out with a gracious response that acknowledges the importance of the request. This validates the person asking the request and lets them know you care about their request. Next, you give the person 2 or 3 alternative ways to meet their need. The human mind likes having choices, and the person will be so occupied making that choice, they will barely notice you said no, and then finally give your reasons. So, as I just mentioned, usually we jump right into the reasons to justify why we can't do something. And although this 3-step technique is simple, it's hard to do. So it takes some practice to reverse the order and give some choices first. That's why it's important to practice. It's also really important to give at least 2 choices, because otherwise it's not a choice, is it? So practice the gracious no outside of work too. It works wonders with children and even with spouses or other family members. So let's see how this looks in practice using an example similar to one of the ones we just described earlier. So the nurse or the doctor, the surgeon in this case, says, "Could you please translate these discharge instructions for the patient?" And the interpreter, following the 3-step saying no model, says, "I would love to be able to do that. The patient needs to understand them." So you can see we are acknowledging the importance of the request. Then we offer 2 or 3 choices. Language Access Services has qualified translators. Perhaps we can check if they have these instructions on file in Spanish. Or we could call Alejandra. She's qualified to do sight translations. Another option is you could go over them orally in your own words, and I could interpret. And then third, give reasons. I'm qualified to provide oral interpreting, but I don't know the written language well, and I'm not trained as a translator. Any mistakes could lead to a medication error or other problems. I don't want to harm the patient or make us legally liable for medical errors. Here's another example. The patient, as she's leaving the community clinic with 3 young children in the snow and sees you, the interpreter, says, "Oh, you were so nice when you interpreted for me today. The kids are so tired. Do you think you could give us a ride home?" The interpreter, again following the 3-step no model, says, 1, "I really wish I could give you a ride home." Again, you're acknowledging her request. And then you're going to offer her 2 or 3 choices. "Let's go back inside. It's warm in there." They could help you call someone, or they might have some cab vouchers. And then lastly, give your reasons. "I'm not allowed to drive patients in my car. If we got into an accident, I could be personally liable for the medical and repair bills. I could also get into trouble at work. I might even lose my job." You seeing how this works? 1, 2, 3. Be gracious and caring, but still holding firm to your professional boundaries. So when saying no, especially in a professional situation as an interpreter, it's important to use your own words so that it sounds natural to you. It's also important to think ahead to what you're going to say and how you're going to say it, so you're not caught on the spot and end up either not saying no when you should or saying it inappropriately. Now, please go to the next assignment where you will have a chance to script out an example of a professional no. Saying no can be stressful, even when we do it right with this 3-step model. So here's a little lotus flower to give you a moment to take a breath. Thanks for listening. See you on the next assignment.